It sits on the campus of the University of Nebraska Medical Center in Omaha, visible from Saddle Creek Road. To many driving past, it's the building with the yellow awning. However, to the people who bring their loved ones to the Munroe-Meyer Institute, it's the place where thankful parents see their dreams come true.
Zebra, nice job.
I would like to thank them from the bottom of my heart because I have a daughter who can tell me she loves me.
MMI is part of UNMC and is Nebraska's federally designated University Center of Excellence in Developmental Disabilities. So we provide a wide array of services, train future practitioners, work with practicing physicians and other health professionals in all issues relating to children, youth, and adults with disabilities. I don't think a day goes by where parents don't talk about the impact of MMI. It may not really be with me, but it certainly is with all of our faculty and staff who directly provide services. It just happens every day. It's very, very rewarding to know that you're able to help families.
My son's name is John Paul. He is 18 months old. He is coming here because he has trisomy 13 and he is not able to sit. We feel very blessed and grateful that we've been given this opportunity. My baby gets to come twice a week and work with an expert for 40 minutes individually. And after just a few sessions, we've already noticed a significant improvement in his ability to sit.
My daughter's name is Addison. She's 5. She has Down syndrome, and she is receiving the speech preschool program through the Scottish Rite. Since we've been involved in this program, we've just seen, she can say, "Come on, Mom." She can say, "Mommy and Daddy."
She would have a story to tell me, and she would come and she would pantomime the entire story. She is saying her ABCs, 1, 2, 3s, and that is huge. We have a different daughter.
But all the magic and all the miracles are based in science. MMI technicians and researchers use the latest learning techniques, technology, and state-of-the-art equipment to change people's lives.
My son is Joshua, and he's 8 years old. Josh experienced a traumatic brain injury when he was about 3.5 years old. We come to Munroe to get therapies for Josh. Originally it was occupational therapy, speech therapy, and physical therapy. It's been an amazing experience with all the progress that Josh has made. I don't know where I would be or my son would be without all the therapists who spent all them years in school and then they care enough to be kind and considerate and gentle and encouraging, all along the way for my son.
My daughter is Bethany, and she just turned 5. Bethany has a major brain defect, so we knew she was going to have a lot of delays, a lot of difficulties. MMI has brought her farther than we ever expected. Her best, we don't know what that's going to be, but MMI, I know, will get us wherever that's supposed to be, whether it's through their programs or through their therapies or through their research. Bethany's going to be right there.
Madison is 2. We've seen a lot of improvement with Madison since she's been here. She has gone from drinking maybe an ounce a day of fluid to almost 13 ounces of fluid, and she wasn't hardly eating anything orally before this, and now during the whole half-an-hour session, she's taking bites every 30 seconds.
My son's name is Tyler West. My son is diagnosed with autism at about age 1.5. Our involvement through MMI has been very, very positive. The therapists have been very caring. The teachers have been absolutely wonderful, and it's probably created as much sanity in our life as we could possibly have. Children that are autistic don't fall into any of what you would consider a K through 12 progression. MMI creates a progression that's individual to each child.
The Munroe-Meyer Institute's diagnostic and genetics programs help parents of children with genetic abnormalities understand their child's condition. But the magic of MMI extends far beyond the yellow awning. 230,000 people in Nebraska have disabilities. And there is a real effort at MMI to get specialists trained to treat disabilities all across the state. MMI treatments and programs are as varied as the ages of the people helped by them.
1984 is when I started coming to MMI, and I was here when there wasn't much here. I'm with the MMI America program. My focus is to find community service projects for all my members, and they put me in charge of finding those opportunities, and it's been a wonderful experience.
Every week, MMI sponsors an after-school program, and children with disabilities from all around Omaha get to do something very important: just be kids.
Our kids have such a good opportunity to come here, be with their friends, see regular peers, learn good behaviors that can help them in their other lives. And it's just a very accepting and affirming and fun time for Grant to come.
As a world-renowned medical center, headline-making breakthroughs occur often at the University of Nebraska Medical Center. But maybe some of the biggest miracles happen with small fanfare to the littlest patients. Maybe the only evidence is a smile and a laugh, or a step, or a tiny hand pointing. Maybe the proof of miracles is best seen on the faces of parents as their child's potential is unlocked, or heard in their grateful voices.
Thank you, Munroe-Meyer, for helping Bethany excel in everything that she's done. Thank you.
Thank you, Munroe-Meyer Institute.
Thank you, Munroe-Meyer. You've changed my son's life and mine. Thanks.